up to date on what is going on with the virus and our response to it. As we've said before, the virus has been, since sometime in March, has been chasing us, but now we're chasing the virus. We are developing and implementing an army of people who will not only be conducting testing all around the state, but also tracking the virus. That is, when someone tests positive, they will be counseled, and those that they came in contact to will be taken down, and they will be contacted as well. And that is what they call the tracking, the tracing of the virus, and that's how we contain it. We know the virus now. We know how it works. We've seen it and we've felt it, and now we're going after it. It's a great statewide effort, and all of this has been in the Accelerate SC meetings that many of you have watched, that you've seen here in this room, with people from around the state with insight into every aspect of South Carolina life, here giving their advice and guidance on things we should do. So we are accelerating. South Carolina, when the virus came, we did not shut down like some other states did, but we did slow down. And so now we're accelerating back up. And we hope to be at full speed just as quickly as possible, but also as safely as possible. So today, I'm announcing the lifting of restrictions on close contact services, and also lifting restrictions on recreational and athletic facilities and activities. They will be lifted as of Monday, May the 18th at 12:01 a.m. Monday, May the 18th at 12:01 a.m., 1 week. Now, the guidelines and recommendations on the safety and sanitary practices by Accelerate SC, which are detailed and comprehensive and can be found on the accelerate.sc.gov website, as well as DHEC and the various other websites. They are excellent, and if followed, they will provide excellent guidance. So what are the close contact services? Those are these: barbershops, hair salons, waxing salons, nail salons, tattoo and massage parlors, and tanning salons. And what are the recreational and athletic facilities and activities I referred to? Those are the fitness centers, gyms, spas, public and commercial pools, yoga, and other exercise facilities. Also today, the Department of Administration has presented earlier today to the Accelerate SC group a comprehensive reentry plan for state employees. You'll recall that on March the 19th, as the virus was coming in upon us, I issued an order for non-essential employees, that is, those state employees that could be deemed non-essential, that could work elsewhere rather than from the office if necessary, to work at home. And they've been doing that. By April the 3rd, we had 55,484 state employees working at home or on leave. Now, I'd say they were working is what they were doing, and we had about 19,003 that were still coming into their regular offices to work. Well, it's time to turn that around now. But as we went into it gradually with our reductions in limitations on businesses, we're also coming out very methodically and carefully. So the first group of state employees will begin returning to their offices once there is ample personal protective equipment on site, but no later than June the 1st, as they will be coming back in. No later. They can start as soon as the equipment is there, but no later than June the 1st. And the regular limitations, the regular rules and hygiene practices will be incumbent upon them as everyone else: social distancing, the sanitizing, the taking the temperature, and travel restrictions. We'll attempt not to have groups traveling in a vehicle together, not going if not necessary. If they can do it remotely, do it that way. If they must travel, then travel in small groups, not large groups. And we will gradually return to normal. And Marcia Adams is here, the Director of the Department of Administration, to answer you any detailed questions that you have on that. We're glad to have with us again today Josie McDaniel Burkett and Holly May. Ladies, again, we appreciate your help very much. We couldn't do it without you. And now Dr. Bell.
Thank you, Governor. And good afternoon, everyone. As our nation and state continues to respond to COVID-19, DHEC remains committed to protecting the health and safety of all South Carolinians. And we want South Carolinians to know that DHEC is doing everything possible to stop the spread of COVID-19. And a component of that is increasing our testing capacity. As of today, a total of 89,968 tests have been performed in South Carolina, covering approximately 1.7% of our population. Of those tests, 7,792 have been positive, and that's approximately 9% positive over time. To assist in this effort, our federal partners have committed to provide DHEC with enough swabs and testing supplies to test 2% of South Carolinians for May and for June. Our goal is to test 2% of the population, or 110,000 South Carolinians per month, and we're currently on track to meet this target by the end of the month. In order to begin the safe transition back to a less restrictive quality of life and vibrant economy, we recognize the importance of increasing access to testing in communities across the state so that we can detect disease activity and understand how well it is controlled. Widespread testing is important in every community because each of us continues to be at risk for exposure to someone infected with COVID-19. But enhanced testing is especially critical in rural and underserved communities where residents may have limited access to health care, limited transportation, and limited access to the internet as an information resource. Expanded testing will allow free testing for all residents and will help everyone continue to take steps needed to help slow the spread of COVID-19. Increasing testing will help us rapidly identify hotspots and outbreaks before they spread and will indicate where resources are most needed. To increase testing in underserved and rural communities across the state, DHEC is working with our community partners throughout the state to set up free mobile testing and pop-up testing sites and clinics to bring testing to these communities, as well as working with some of the traditional medical homes where people can find ongoing care. We currently have 14 mobile testing clinics scheduled across the state, with more planned in the coming days. We will continue to inform the public of locations of COVID-19 test sampling sites, including multiple and pop-up clinics. With increased testing, there will now be an increase in the number of positive cases reported. And this means we'll need to expand the extent to which we can provide contact tracing for positive cases, and we are prepared to do that. Contact tracing is a disease control measure that is commonly used by public health officials, and during normal operations we have approximately 20 contact tracers who find the contacts of certain infectious diseases, like tuberculosis or hepatitis, for example, to help us limit the spread of those diseases. And DHEC has been conducting contact tracing for COVID-19 since the first report of that infection in South Carolina. As we enhance our testing efforts, DHEC set goals with our Accelerate SC partners to identify 1,000 contact tracers by May the 31st. And I'm pleased to announce that we have met that goal. As of today, we now have 400 contact tracers on staff, and we've retained another 1,400 contact tracers through contracts with 2 private staffing companies. That's the Apple One and C-Trace. And in addition, we've had over 660 members of the public who have expressed an interest in becoming contact tracers through our contact tracing webpage. As people from across the state ask what they can do to help stop the spread of COVID-19, our response is to be socially responsible and community-minded, and to continue to practice social distancing, wearing a mask while out in public, to avoid touching frequently touched items, regularly washing your hands, monitoring for symptoms, and to seek testing if you are ill or if you think you've been in contact with someone who has COVID-19 infection. If you have tested positive or have been exposed to someone who has tested positive, one of our team members will reach out and will make sure that you have the information that you need to help protect yourselves and your community. And for the latest information and updates on COVID-19, please visit our website at scdhec.gov/COVID-19. Thank you.
Thank you, Dr. Bell. It's quite something to have 660 people volunteer to be contact tracers. That says something about our people. So, with that, are there any questions? Yes, ma'am.
Governor, walk us through some of the restrictions or some of the new processes that will be in place in these hair salons, nail salons, gyms. What kind of requirements will be in these facilities?
There'll be the ones that you have heard of before about every other seat will ask to be not used, that they do it by appointment, they not have people in the waiting room, that they clean all the equipment, everyone washes their hands, customers as well as they go in, that the workers there, the people providing those services will wear masks or wear shields and wash their hands and wash the equipment, and all of those things that you've heard. But it goes into some detail because all these services are a little bit different. But a lot of thought went into them. They're common things.